Nobody told me how hard breastfeeding could be. I wish that I thought about the psychological effect of trying to create milk for your child who desperately needs it and the milk isn't coming out the way you expect. That can mess with your mind. So just give yourself grace. Like, how y'all keep having kids if your back feels like it's gonna just break off and walk away from you? Welcome to my channel. My name is Grace, and on this channel we are all about elevating our mom glow up through practical self-care. So in this video, I'm going to share with you 7 things that I wish I knew prior to PCOS pregnancy. So a little background about me. If you've watched any of my videos before, I've done several videos about PCOS and how I healed myself naturally from PCOS to be able to get pregnant. I'll make sure that I actually tag the playlist below in the description box. But something that I also wanted to know is that it would be remiss of me not to tell you some of the hardships that came with getting pregnant with PCOS. I've had PCOS since I was 19 years old and started trying to get pregnant when I was 27, and it took about 5 years or maybe 6 years before we were able to finally get pregnant. When you have PCOS, you are so consumed with everything that you need to do to kind of prepare your body for pregnancy and everything you need to do to make sure you ovulate and everything else. But I think one other step that I wasn't thinking about was what pregnancy feels like when you have PCOS. One thing that I experienced earlier on in my pregnancy journey was low progesterone. If you are someone who has PCOS, you have a high likelihood of actually experiencing low progesterone, which can lead to miscarriage. When I was pregnant, I was ecstatic. I mean, I couldn't believe it. I was shaking. I took the pregnancy test to my husband and I'm like, what's going on? Like, we've been trying for so long. I can't believe this is happening. And I remember, as I mentioned, I worked with a naturopathic doctor who was also a herbalist. And I had a meeting with her and she told me, I need you to go and get your progesterone and your HCG tested. When you go to the hospital to get tested to see if you're pregnant, they typically check for your HCG levels. They don't usually check for progesterone, but she asked me to go get my progesterone tested, so I had to pay out of pocket for it. And I am so thankful that I did, because she realized immediately that my progesterone levels weren't as high as they should have. So if she hadn't caught that, that actually brings up the risk of having a miscarriage. So if you're somebody who has PCOS, and you eventually get pregnant by God's grace, then I want you to make sure that even if you have to pay out of pocket for it, you should definitely get your progesterone tested. You want to make sure that you have the right amount of progesterone for how far along your pregnancy is. So something that she had me do was actually buy a progesterone cream that I would rub either on my arm or on my thigh, and that actually helped to boost the progesterone level and also helped through that first trimester to make sure that I didn't have a miscarriage. So that was the first thing that you want to pay attention to. If you have PCOS, you have a higher likelihood of experiencing gestational diabetes. Because we often have insulin resistance or high blood sugar, it makes sense that you could be exposed to gestational diabetes. Fortunately, I did not experience this. However, I did have to take multiple glucose tests during the span of my pregnancy just to make sure that everything was looking good. So one of the things that you still have to make sure that you're doing is eating as healthy as possible while pregnant. And I know this can be difficult because when you hear other people get pregnant, they get to eat the ice cream, they get to indulge, but that's not the case when you have PCOS. We cannot overindulge on anything. So you really, really need to make sure that you are checking your blood sugar, you are not eating things that are going to spike your blood sugar too much, and you just want to do what you can do from your part to prevent gestational diabetes. If you enjoyed this video so far, please make sure you hit that subscribe button and also like this video so that I can know if you like this kind of content in the future. PCOS generally can contribute to the possibility of having high blood pressure, but while you're pregnant, it can definitely contribute to the instances of having preeclampsia. Black women typically have higher rates of preeclampsia in comparison to other races. So that's something you want to keep in mind. Like, this is not something to scare you, but you just want to keep these things in mind so that if they do come up, you know that it is a possibility and you are ready to fight. You are ready to you're not breaking down and you are ready to push through. I didn't have preeclampsia until the very end of my pregnancy. Preeclampsia can cause your child to have a low birth rate, and it can also compromise the integrity of your placenta. So this sounds scary, I know. Towards the end of my pregnancy, I did have preeclampsia, but this was like at the tail end of it. So I had to constantly watch what I was eating, making sure that my blood pressure didn't go up. I was also being cognizant of like the information and the people that I was surrounding myself with. I was staying in a positive mindset. You want to make sure that you are exercising enough to get enough oxygen to your body, into the placenta, to the baby. You want to saturate yourself with as much oxygen. Go outside. Go for those daily walks. Take your partner with you and just make this like a routine that you start earlier on in your pregnancy journey, because it is going to be super helpful to you. And this was something that I wish I knew. Thank goodness I didn't experience it until the tail end of my pregnancy. However, it was still quite scary, so just keep this in mind. The fourth thing that I wish I knew was that inflammation ain't going nowhere. I mean, I had so much inflammation. Everything was achy and everything was hurting. And this was something that I thought would happen towards the later end of the pregnancy, but I felt like I had inflammation throughout. So again, doing those exercises, doing those stretches was super, super important. If you decide that you want to get a massage, make sure you're going to a practitioner that specializes in pregnant women. You don't want to go to any old person and have them pushing all up on your body, because they can push the wrong thing. So you want to make sure that if you decide that you want to get some sort of massage, you're going to a person who is specialized in massaging women who are pregnant. Something like coenzyme Q may be something that you want to take to make sure that you're reducing the level of inflammation you're experiencing. So definitely talk to your doctor, your naturopathic doctor, whoever it is that is monitoring your pregnancy, and remind them that you have PCOS, that you're experiencing inflammation, and what are some supplements that are pregnancy safe that you can take just to support your body. The next thing that I wish I was aware of was the breastfeeding challenges. I mean, nobody told me how hard breastfeeding could be. But if you have PCOS, you have a high likelihood of just not producing enough milk. And I think I wasn't ready for that reality. I mean, breastfeeding was hard. It was harder than I thought it would be. And I think it's because women just generally don't talk about these things. I mean, all we hear about is the joy of motherhood and the milk is really good for the baby. Yes, but breastfeeding was a challenge. And I wish that I had more honest conversations about it. I wish I heard more honest conversations about it. I wish that I thought about the psychological effect of trying to create milk for your child who desperately needs it, and the milk isn't coming out the way you expect. I mean, that can mess with your mind. So just give yourself grace and don't have too much expectations. Like, I'm only gonna exclusively breastfeed. You don't know that yet. So don't make those decisions yet. Allow your body the time to like do what it needs to do, and forgive it if it's not doing what you expect it to do. I wish that I had that kind of honest conversation with somebody. The next thing that I want you to keep in mind is actually consider chiropractic care. This saved my body during pregnancy. I started chiropractic care, I think, at week 8 or 12, between that. And it really was helpful because prior to going to the chiropractor, I was in so much pain. I was having this debilitating back pain. And everyone was telling me this pain was normal. And I was always crying in pain. I would sit in the tub and just like rock back and forth in excruciating pain. I couldn't breathe. And I'm like, if everyone is feeling this kind of pain, how are they having kids? Like, how y'all keep having kids if your back feels like it's gonna just break off and walk away from you? That's how my back felt. It was always on fire. And I was like, something is wrong. This is not normal. And if you go to the traditional hospital, they're just gonna try to give you some drugs. And that was not what I wanted to do, because honestly, I wasn't sure how it was gonna affect my child. And most of the time, the only thing, the only thing they're really gonna prescribe to you is Tylenol. And Tylenol was not doing nothing for the pain, honestly. Because I tried Tylenol and I was just like, this is not doing anything. I need something else. So my husband and I decided, let's try going to the chiropractor, and this saved everything. I had some sort of misalignment in my back, and that was causing me this excruciating pain. It had nothing to do with the baby. All the hormones in your body is relaxing your body and your ligaments because it's trying to get it ready to expand so that it can hold a child. So everything was just going out of alignment, and I was in a lot of pain. And thank God my husband listens. Thank God my husband listened to me, and it took me to the chiropractor. Again, you want to find one that actually specializes and works with women who are pregnant and also works with babies. And we were lucky enough to find one that was like just a few minutes from the house. And this really saved my back. This saved me from a lot of pain. And then there's a point in pregnancy that you're gonna start having that pelvic pain. My chiropractor was able to save me from that pain as well. Just giving you these different stretches, massaging your back, realigning your spinal cord, just kind of like putting your body in the optimal space for it to carry the baby, effectively and efficiently, and also give you exercises that you can do at home to just start getting your hips ready to carry your child. It gave me different exercises to do on this big bouncy ball thing. I think it's a yoga ball, I'm not sure, but like this big bouncy ball, and it would tell me to like rotate my hips and my waist, and just doing those things helped with like just getting the baby to sit in the right place in the pelvic region, and also reduce the level of pain that I was experiencing. So if you get into pregnancy and you're noticing that you're having a lot of body aches, your back is aching, and you're having pelvic pain, it may not be anything associated with like the baby per se. It could just be your ligaments are just not feeling real good. You may need some sort of adjustment to help you get things to start moving better. Mind your nutrition and also eat as healthy as you can. I'm not saying you need to eat a kale salad every day, but I am saying that we cannot use the excuse of we're eating for two to overeat, because that's actually not true. You don't actually need to eat for two. That's like a myth, right? So we don't want to gain too much weight while you have PCOS. So you want to get enough weight for your child, but you don't want to like get really, really big, because it's going to be hard for you to lose that weight later on. And it also increases your risk for all those other factors I mentioned, such as preeclampsia. So when I went to the hospital, that was something that I was clearly told. Like, at your weight level, we don't need you to gain a ton of weight, and we don't want you to eat for two. So that's something I want to tell you. You don't need to eat for two. Eat a balanced diet that's going to be good, that's going to give you the nutrients that you need for your body and for your baby. So there you have it. We talked about 7 different things that I wish I knew through my PCOS pregnancy. And those things were the fact that you needed to check for low progesterone and risk of miscarriage. You want to make sure that you're checking your blood sugar and also the risk for gestational diabetes. You want to make sure that you are checking your blood pressure and also risk for preeclampsia. You want to definitely manage your inflammation. You want to prepare yourself for any breastfeeding challenges that can arise from having PCOS. You want to consider chiropractic care, because that can help you with like realigning your body and just helping the baby fit better in your pelvic region. You want to mind your nutrition and make sure you're eating as healthy as possible and you're not eating for two. Remember that you always have to do your research. This is me sharing some of my personal experiences with you, but I want you to do your research to figure out what's best for you. If you enjoyed this video and you found it valuable, make sure you like, subscribe, and check out this next video.